How can we, as crisis workers and mental health service professionals, mitigate the long-standing distrust between the Black community and mental health as a field? How can we serve communities of color better than we do now, especially if we individually are not Black?
We have to have the science that tells us what works and what's effective for these populations. And we really don't have that level of commitment. And I think, it's important that we do push for that. And those in the field push for that so you can have the information and knowledge that you need to understand how different people are experiencing maybe similar stressors, but very differently. And particularly for different ethnic groups. And of course, intersection by gender and even sexual orientation, right? You have to take up and understand whether or not you're engaging in humanizing or dehumanizing care. This is not just to be culturally sensitive. Are you recognizing the humanity in someone? The idea that you have seen people call in and your automatic thought is to say, I understand what you're talking about without paying attention to whether or not you're even listening to the person anymore. And the ability to describe what they're experiencing and what their stress and what their needs are. So we have to really dismantle dehumanizing care. And whether or not we're doing that because of racism-based or white supremacy-based ideas, or we're doing that because we're so experienced that we no longer think we have to really listen to people before we talk about how we can help people. Also within your systems, the centers, the institutions, you have to examine with an equity lens how you're engaging and facilitating opportunity for those different levels of practitioners and clinicians to rise to the level of leadership and ability to offer new ideas, new practice-inspired visions for how we provide care to different populations. It can no longer be, as we used to say, it can no longer be a Black History Month conversation. It has to be an every month conversation. That means our equity lens has to be very clear. We have to open up our minds and examine our own practices. And I call it practices of opportunity to lead, opportunity to inform, opportunity to learn. If we don't take that lens now, and to be able to say, it's okay that I've been wrong. We have to give people the space, kind of truth and reconciliation, to say, it's okay if my agency has been wrong, I'm just ready to do the right thing. And if we don't give that space to each other to be able to get there, then it's hard for those at the top making decisions to change, because they're not going to be open to that for a long period of time. And then for those who are trying to seek change, because they're the ones looking for opportunity, they might not have that window. So we have to be able to do both.